Hello, and welcome to the Cold-Related Injuries Employee Training video. Our objectives for this training are: identify two types of cold-related injuries, and list two groups of people at higher risk. A question you might ask yourself is, how does the body react to cold conditions? Well, in a cold environment, most of the body's energy is used to keep the internal core temperature warm. Over time, the body will begin to shift blood flow from the extremities and outer skin to the core. This shift allows the exposed skin and the extremities to cool rapidly and increases the risk of frostbite and hypothermia. What are the factors affecting body temperature? If you remember from your hot weather training, temperature plus humidity equals the heat index, and those combined can make you feel hotter. But with the cold weather, we look at the temperature along with the wind speed to establish what is known as the wind chill index. The wind chill is the temperature your body feels when air temperature and wind speed are combined. An example of this would be when the air temperature is 40 degrees Fahrenheit and wind speed is 35 miles an hour. The effect on the exposed skin is as if the air temperature is 11 degrees Fahrenheit. TDCJ uses this index in local news, weather media, and weather conditions recorded by instruments located at the unit to determine the safety of cold weather working conditions. There are some groups of people that are at higher risk for cold-related injuries. First, your outdoor workers run a higher risk. Elderly. Certain health problems can put you at a higher risk, such as hypertension, hypothyroidism, and diabetes. Individuals not properly dressed or who allow their clothing to get wet, as with sweating. What are the most common cold-induced injuries that you need to be on the lookout for? Hypothermia and frostbite, and we will discuss these individually. First, what is hypothermia? Hypothermia occurs when body heat is lost faster than it can be replaced and the normal body temperature drops to less than 95 degrees Fahrenheit. Hypothermia is most likely at very cold temperatures, but it can occur even at cooler temperatures, above 40 degrees Fahrenheit, if a person becomes chilled with rain, sweat, or submersion in cold water. Some of the initial symptoms you might notice is shivering or stomping of feet. This is a bodily function in response to early hypothermia or just feeling cold. When the body temperature drops, the shivering reflex is triggered to maintain normal body temperature. As the body temperature continues to fall, symptoms will worsen and shivering will stop. The worker may lose coordination and fumble with items in hand, become confused and disoriented. He or she may be unable to walk or stand, pupils become dilated, pulse and breathing become slowed, and loss of consciousness can occur. A person could die if help is not received immediately. Now, let's talk about frostbite. Frostbite is an injury to the body that is caused by freezing of the skin and underlying tissues. The lower the temperature, the more quickly frostbite will occur. Frostbite typically affects the extremities, particularly the feet and hands. Amputation may be required in severe cases. Reddened skin will develop white or gray patches as seen in this photo. Other symptoms include numbness. Area can feel firm or hard. Blisters may occur in the affected part in severe cases. Here are some other examples of what frostbite looks like. So now that we know what we're looking for in frostbite and hypothermia, let's talk about the treatment. First, call medical. If medical is unavailable, then follow these guidelines. Bring the distressed person out of the cold and restrict any further duties or activities. Remove any wet clothing and insulate the person with dry, warm blankets or clothing. Ensure all constricting items of clothing and footwear are removed from injured areas and the injured areas are covered. If frostbite exists, gently heat the affected area with warm water, towels, a heating pad, or hot water bottles. Do not rub the area or rupture blisters because this will cause further tissue damage. If a lower extremity is affected, treat by slightly elevating the affected area. If the person is alert, encourage consumption of warm sweetened liquids, but never put liquids or food in someone's mouth when not alert, as choking and aspiration will occur. If necessary, call 911 and initiate CPR. If evacuation from cold requires travel on foot, do not thaw the affected area until the person reaches medical. If the area is thawed, then on the way for medical help, the area refreezes, the tissue damage will be worse. Transport the offender to medical as soon as possible and continue treatment during transportation. We have many guidelines in place so that extreme weather injuries do not happen. They include offender acclimation, hourly temperature reports, annual staff and offender training, guidelines for proper clothing such as thermal underwear, insulated jackets, and gloves. Also, care should be taken to prevent perspiration, which could soak clothing and compromise the insulation value of the clothing. Now that you have completed this training, let's see how well you can answer these questions. Which cold-related injury is most serious? That is correct. Hypothermia is life-threatening and can result in death. People at higher risk for cold-related injuries are all of the following except A. Elderly, B. Certain health conditions, or C. Women. If you chose answer C, then you are correct. Higher risk groups include elderly and certain health conditions such as hypertension, hypothyroidism, and diabetes. Okay, last one. Offender Doe is working in the field squad and starts to complain of hand pain. You notice that his hands are red with white splotches on the fingertips. Which action is appropriate? Would you tell the offender you have 2 more hours to work, then you can see medical? Or would you restrict further work and have offender transferred to unit for medical evaluation? The correct answer is B. Restrict further work and have the offender transferred to unit for medical evaluation. You should also try to gently rewarm the area if the transfer to medical is not delayed. In conclusion, here are some safety tips to help keep you injury-free this winter. Knowing the symptoms of cold-related injuries, monitor your physical conditions and that of the people working around you, dress properly, stay dry, and drink warm, sweetened fluids. And most of all, be safe.